Okay, so today we're going to go over on how to use the probe. So first we have the handle, the shank, the terminal shank, and the working end. And on here, we read it by millimeters. Each line indicates a single millimeter. So there's 1, 2, 3, 4, 5. The thicker line indicates 5. Then 6, 7, 8, 9, 10. The thicker line indicates 10. So how we hold the probe is we're going to use a modified pen grasp, and we're always going to hold the probe with light pressure. You never want to dig deep down and you'll be able to hurt the patient. You never want that. So why do we probe? There are a few reasons on why we probe. We want to get the perio reading so we can get the pocket depth. You also want to get furcation involvement, CAL, recession. So when we probe, we're going to probe on every single patient that we have in our chair. And along with that, we're going to do a bleeding index on the patient, plaque scores. So how we do probe is we're going to probe, we're going to go from the, measure from the gingival margin all the way to the junctional epithelium. You'll be able to feel when to stop, and also on a live patient, you can see the tissue blanch. So there's some contraindications on when you wouldn't probe a specific tooth. Is if there's an abscess, a periapical abscess, the tooth is in some sort of distress, for fractures on the tooth. So there's a certain working order that you always do when you're probing. You're going to go from the upper right, which starts at tooth number 1, and you're going to go to the upper left to tooth number 16. You're going to start with the buccal, and then you're going to drop down to the palatal side of 16 and go back to tooth number 1. After that, you're going to drop down to the lower right. You're going to start at tooth number 32, the buccal side, do the buccal of all of the mandible. Then you're going to end at tooth number 17, buccal, and then you're going to go to tooth number 17, lingual. You're going to do a lingual of all the teeth, and then you're going to end at lingual of tooth number 32. So when you're probing, you don't necessarily have to sit at any sort of clock position. It's whatever you're most comfortable with. Just so you can see the best, I'm going to start at tooth number 1. I'm going to always start at the distal line angle. You're going to do a walking method and end distal. So you're always going to want to hold the probe along with the apex of the tooth. But when you get to the distal, you're going to want to go on an angle so you know you're all the way in the sulcus. Then you're going to walk back to get to the middle. Then you're going to walk to the mesial. And again, you're going to end on a slight angle. So for each tooth, you're going to get 6 readings. You're going to get mesial, facial, and then you're going to get distal. Then you're going to get 3 on the palatal or the lingual surface. So we're going to go to tooth number 2. You're going to go, always end on an angle. End on an angle again. And at an angle. Probing will also indicate if there's any inflammation. If there is significant inflammation, some patients will bleed. Always do the walking method, end on angle. So I'm going to do a hypothetical numbers for tooth number 8. So say I got a whole bunch of 1s and then the highest was a 2 for the mesial. I'm sorry, for the distal, I would say that's a 2. Then going back, for the facial, I got a whole bunch of 2s, and all of a sudden it drops to a 3. I would say the facial's a 3. And then for the mesial, got a whole bunch of 1s, then again for a 2, then I would give it a 2. So it would be 2, 3, 2. So now I'm going to do the palatal side. So now I'm going to start with the mesial of the tooth first. Always end on an angle. Again, you always want to get 3 readings per tooth. And when probing, you're going to find out where is most comfortable for you, and you don't always have to sit at the same clock position the entire time when you're probing. I find it most comfortable to sit at a 12 o'clock position for most of my time while I'm probing. I feel like it's the easiest way I could get the probe into the sulcus on that angle.